Health and medical preparation for Aliyah represents the delightful challenge of convincing two entirely different healthcare systems that you are, in fact, the same human being who has managed to survive this long without their mutual consultation. This process transforms ordinary people into amateur medical detectives, professional record hunters, and part-time translators of doctor handwriting that resembles ancient hieroglyphics mixed with abstract expressionism. Medical records collection, an archaeological adventure. Begin collecting comprehensive medical records 12 to 18 months before departure, which sounds reasonable until you discover that obtaining your own medical information requires more security clearance than accessing government secrets. Your GP's receptionist will treat your request for medical records with the suspicion typically reserved for journalists investigating royal scandals, as if asking for documentation of your own health history is some sort of elaborate insurance fraud. The NHS record system operates on the principle that information should be stored in the most inconvenient format possible across multiple locations that may or may not still exist. Your childhood vaccination records are apparently housed in a filing cabinet somewhere in Scotland, while your recent blood test results are stored on a computer system that was cutting edge when dial-up internet was revolutionary. Requesting digital formats reveals that digital in NHS terminology means photocopied and scanned at resolution suitable for ant vision. Contacting specialists for comprehensive records involves navigating phone systems designed by people who clearly believe that reaching human contact should require the persistence of Olympic endurance athletes. You'll be transferred between departments like a hot potato while explaining repeatedly that yes, you do need your own medical records, and no, this isn't some elaborate attempt to steal medical identities or commit healthcare fraud. Hospital records from previous admissions require archaeological skills, as hospitals apparently store patient information using organizational systems developed during medieval times. Your surgery records from 5 years ago are filed somewhere between ancient history and probably threw it away, while more recent emergency room visits are documented with the detail typically reserved for grocery shopping lists. Decoding Israeli healthcare. Choose your own adventure. Understanding the Israeli healthcare system requires learning that unlike the gloriously straightforward NHS approach of everyone gets everything, eventually, Israel operates 4 different health funds that compete like reality show contestants for your medical loyalty. Clalit, Maccabi, Muhadet, and Lumit each have networks, coverage options, and bureaucratic procedures that make British queuing systems seem like models of efficiency and organization. Researching health fund differences involves comparing services that seem designed by committees who couldn't agree on anything except that nothing should be simple or straightforward. One fund might excel at cardiology but treat dermatology like mystical arts, while another provides excellent mental health services but considers orthopedics an optional luxury. Your choice of health fund will affect everything from which doctors you can see to whether your preferred brand of antacid is covered. Each health fund operates with supplementary insurance options that require decision-making skills typically reserved for NASA mission planning. You'll study coverage charts that read like insurance policy Mad Libs, trying to determine whether enhanced specialist access means you can see a cardiologist within your lifetime or merely within the current decade. Medication management, lost in translation. Creating comprehensive medication lists reveals that pharmaceutical naming conventions operate like witness protection programs, where the same drug has different identities in different countries. Your trusty British medications have Israeli cousins with names that sound like they were created by someone playing pharmaceutical Scrabble after consuming too much coffee. Researching Israeli medication availability involves navigating Hebrew websites using translation software that apparently learned medical terminology from fortune cookies and romantic poetry. Your essential blood pressure medication might be available under a name that translates roughly to Happy Heart Helper, while your antidepressant could be called something that Google Translate suggests means Cheerful Mind Assistance Powder. Obtaining sufficient medication supplies for the transition period requires convincing your British GP that you're not starting a black market pharmaceutical operation or planning to corner the Israeli market on British-made stomach remedies. They'll eye your request for 3-month supplies with suspicion typically reserved for people asking for industrial quantities of cough syrup. Some medications require special import permissions that involve paperwork more complex than diplomatic treaties, while others are simply unavailable in Israel, apparently because Israeli pharmaceutical committees have different opinions about what constitutes essential medications. Your beloved British allergy tablets might be considered controlled substances requiring documentation that exceeds most legal proceedings. Dental records, archaeological excavation of oral history. Dental records collection requires convincing your dentist that comprehensive oral health documentation is actually important rather than some peculiar obsession with dental bureaucracy. British dental records apparently operate on the principle that if your teeth haven't fallen out completely, documentation isn't really necessary beyond "seems fine, see you in 6 months." Requesting recent X-rays reveals that dental X-rays are stored using organizational systems that would challenge professional archaeologists, possibly filed under "that one time we took pictures of teeth," or organized by lunar calendar systems. Your dentist will look at you with confusion when you explain that Israeli healthcare providers might want actual evidence of your dental health status. Israeli dental care operates on entirely different principles from NHS dental provision, where routine care might involve costs that exceed most people's vacation budgets. You'll discover that dental procedures you assumed were basic human rights are actually considered luxury services requiring financial planning typically reserved for purchasing automobiles. Vaccination records. Immunization detective work. Compiling vaccination records requires detective skills that would impress Scotland Yard, particularly for childhood immunizations administered when record-keeping involved handwritten cards that have since achieved historical artifact status. Your mother will claim she kept all vaccination records somewhere safe, which translates to probably in the same place as your baby teeth and primary school artwork. School vaccination records might be stored at educational institutions that may or may not still exist, filed under systems that predate modern computing by several decades. Contacting former schools involves conversations with current staff who treat requests for decades-old vaccination records like inquiries about ancient civilizations. Israeli vaccination requirements operate on principles that suggest childhood diseases have geographical preferences, requiring catch-up vaccinations for conditions that apparently don't cross international borders according to British immunization schedules. Your children might need booster shots for diseases you've never heard of, administered according to schedules that seem designed by people who believe more injections automatically equal better health. Mental health records, psychological paperwork, pandemonium. Mental health service transitions involve explaining to British mental health providers that yes, other countries do have qualified psychiatrists and psychologists, despite what British professional superiority complexes might suggest. Your current therapist will express concern about Israeli mental health services with the worry typically reserved for discussing primitive medical practices in developing nations. Israeli mental health coverage varies by health fund like menu options at restaurants, where some funds treat psychological services like essential health care, while others consider therapy roughly equivalent to luxury spa treatments. You'll research coverage options while wondering whether your anxiety about healthcare transitions qualifies as pre-existing conditions requiring special documentation. Transferring psychiatric medications involves convincing multiple medical professionals across 2 countries that yes, your brain chemistry will remain roughly the same after crossing international borders, and no, geographical relocation doesn't magically cure chemical imbalances through exposure to Mediterranean sunshine. Chronic condition management, long-term care, logistics. Managing chronic conditions during international relocation requires coordination skills that would challenge United Nations peacekeeping operations. Your current specialists will treat your relocation announcement like personal betrayal, as if moving to Israel represents abandonment of British medical excellence for inferior foreign healthcare systems. Diabetes management transforms into complex logistical operations involving insulin supplies, glucose monitoring equipment, and dietary adjustments that account for different food availability and measurement systems. You'll research whether Israeli pharmacies stock your preferred glucose test strips, or whether you'll need to adapt to different brands that might provide readings in alternative measurement units. Heart condition management requires explaining to cardiologists that Israeli hospitals do, in fact, have modern cardiac equipment and qualified heart specialists, despite what British medical pride might suggest about foreign healthcare capabilities. Your medication regimen will need translation not just linguistically but also into equivalent Israeli pharmaceutical options that might have different dosing schedules or formulation strengths. Children's health, pediatric preparation pandemonium. Children's health preparations involve convincing pediatricians that Israeli children develop according to the same biological principles as British children, requiring similar healthcare approaches and vaccination schedules. School entry requirements might demand health documentation more comprehensive than diplomatic credentials, including growth charts, developmental assessments, and immunization records that span your child's entire educational career. Pediatric specialists will express concern about healthcare continuity, as if you're relocating to remote wilderness areas without modern medical facilities, rather than moving to a country with internationally renowned medical institutions and universal healthcare coverage. You'll research Israeli pediatric services while fielding advice from British medical professionals who seem convinced that foreign healthcare automatically equals inferior care. Emergency preparedness, crisis management planning. Researching Israeli emergency services reveals that medical emergencies operate according to different protocols than British systems, where emergency contact numbers, hospital procedures, and urgent care access follow entirely different organizational principles. You'll memorize new emergency numbers while hoping you never need to test Israeli emergency response efficiency during stressful medical situations. Emergency preparedness involves creating medical summary documents that can be understood by Israeli medical professionals who might not share your British assumptions about normal medical terminology and standard treatment approaches. Your emergency medical information needs translation into formats comprehensible to healthcare providers who weren't trained in British medical schools with British diagnostic approaches. The Great Healthcare Transition. Reality meets expectations. The actual healthcare transition reveals that establishing medical relationships in Israel requires patience levels typically reserved for waiting for British public transportation during severe weather disruptions. Israeli healthcare providers will want to repeat tests, evaluations, and procedures that were recently completed in Britain, apparently because medical results don't travel as well as luggage across international borders. Budgeting for transition healthcare costs involves financial planning more complex than retirement savings, as services you assumed were universal human rights might require co-payments, supplementary insurance, or private payment arrangements. Your healthcare budget will be adjusted more frequently than government economic forecasts, usually upward and with increasing concern about long-term financial sustainability. The ultimate irony reveals that Israel's healthcare system is internationally recognized as excellent, with medical technology, specialist care, and treatment outcomes that frequently exceed British standards. However, accessing this superior healthcare requires navigating bureaucratic systems that make British red tape seem like streamlined efficiency models, while adjusting to healthcare cultures where patient advocacy involves more assertive communication styles than British politeness typically permits. This magnificent healthcare adventure transforms ordinary immigrants into amateur medical administrators, professional healthcare navigators, and part-time medical translators who develop expertise in international healthcare systems that exceeds most medical tourism professionals. The process ensures that by the time you successfully establish healthcare in Israel, you'll have acquired enough medical bureaucracy experience to consult for international healthcare organizations or write comprehensive guides for other bewildered immigrants attempting similar healthcare system transitions.